When you first came here, that was in January 23rd, that was our first clinic. And at that time, we were aiming to do 300 and something that day. When you first start, it was a bit slow. Now we've done 22 clinics since then. And this is, yeah, as you said, this is our potentially last clinic until maybe the booster clinic come in autumn time, where we have to wait to hear from the government. As of today, we've done 7,425 patients, first and second doses combined. And we've also done all the home housebound patient or patients in nursing homes that were due, and they also had the vaccines too. So I think we have come a long way, but still a long way to go, and we should not be complacent.
Do you think, looking at those figures now, would you have imagined getting those figures when we first spoke in January?
No, absolutely not. Because right at the beginning, we've never done COVID clinic before. It's not like a flu jab clinic. You just come in and get it done, one patient per minute. It's not like that. You have to go through the risk factor, have a chat, and it takes a longer time. And at the beginning, as I said, the first clinic, we're only able to do 500 something patient, but we ran on till 8 o'clock that day. But with experience, I remember several weekends ago, we did 1,000 patient plus, and we finished at about 3-4 o'clock. So I think we've gone a long way. We know how to run it now, and in the future, when we do the booster jabs, it will be exactly the same. Hopefully, we'll be able to do it with the flu jab as well.
And we've just seen you talk to your team and thank them for all the hard work. I mean, it's not an easy operation, would it? I mean, how has the team come together to achieve this?
So luckily we've got our admin lead, Nina. So she basically runs the whole thing. She will organise who come in to do the clinic on what date, the admin person doing the computer work. So we work as a team in a room. So I will be doing the injection, whereas my admin person will be looking up the patient and put the detail onto the central system. So it has to do it right. It has to be methodical. And she was able to do that for us, and also booking patient in. So the way that we get our vaccine is you only get a call, maybe an email saying, this is how many you're going to get on what day. So then you have to quickly call people or send a text to them and say, please book in. So that's why some people said, well, I've never been called. Well, actually, we're still organising it. It's very short notice. And I think it works well. Patient get a text, they come, and you can see today there's no queue. Because I think we've done it so many times now, we are quick. So yeah, and there's quite a lot of organisation in the car park, people need to know where to park. So we've got traffic control out there, traffic control inside, making sure they go to the right room. But yeah, we get there.
Has this had a big impact on the surgery as a whole? Because it's disrupted your normal everyday workings, hasn't it? So how have you integrated the two?
Actually, we're lucky because the way that we work is we've got 2 sites. So C4 Farm Surgery, just across the road, have majority of the clinicians there. And most of our COVID clinics run on a Saturday. So it doesn't actually affect us much. The home visit is done by a nurse and a doctor, generally on a Friday when Dr. Spencer does it. And that works well because there's no disruption to her usual working day. And sometimes here on a Wednesday night, we've been running clinics too, but I work late on a Wednesday anyway, so I do that cover too. So generally speaking, during the day, there's no disruption at all. And in fact, now we are going to another phase of, releasing lockdown and stuff like that. We are planning to provide more clinics, more face-to-face. I understand that the news been going saying that people need to have face-to-face appointment, and I agree. But actually, quite a lot of the things that we encounter can be done via our e-consultation or via phone call and video call. We've got loads of technologies that we can utilize. So what we normally do is when someone call up, there will be triage and then get a phone call from a clinician, and the clinician will decide whether you should come and be seen or not. So maybe a skin lesion, sometimes it's much easier if you can send in a picture, but obviously listening to a chest, you have to come in. So it all depends on the situation.
So Monday is going to be a brand new week for you. What happens from there?
Right, we've got good news. So I don't know whether you're aware, in the past few years we've been having difficulty hiring doctors. We've been trying all the time, but just no news. But recently we've hired a few doctors for the surgery. In fact, I think we've got five extra on top of what you have already got, and they all got different skill sets and they all work different days, so it's covered the whole week well. So generally speaking, I think we'll be able to provide more appointments, being treated more efficiently, and they have got this special extra skill. For example, some of them like to do minor ops, some of them are very experienced GP, and some of them like to do diabetes, for example. So you have got choices.
So I think over the past, well, it's common knowledge really, over the past 12 months, a lot of people have refrained from coming to surgeries. You know, they may have sickness or, you know, injuries that they just haven't seen a doctor about, partially because they don't want to come to a surgery. They feel as if it's not important enough on top of COVID. And the other side is they probably haven't been able to come to the surgery. So
Yes.
Monday, as I said, is a brand new week. So that's going to change, isn't it?
It's absolutely going to change, and I think the triage, although it's still going to be ongoing, don't worry about not getting a face-to-face appointment. The clinician will go through the cases. If it can be done via the phone, video, camera, technology, we'll do that first. But eventually, if we feel that you need to come in, we'll bring you in. So do not feel that your problem is not important, because I have seen cases that some people think that it's not important. It turned out to be quite important and should have been done sooner. And anything you worry about, just contact us and we'll be there for you.
So finally, Dr. Chan, how would you look back on the last 4 months?
Interesting. I think we have to work innovatively. And this is something that general practice are quite good at doing, I think, because in the past, if you just look back to last year, we never used e-consultation. We never just used, phone triage first. We see everyone face to face. And was it actually effective? Not necessarily. Some people might not be free to come in for an appointment, but they are free to talk on the phone and send in a picture. So, now we've got different sources of technology. We should utilize them for different kind of people to suit their needs. And I think we have done well to kind of adapt, and being adaptive is what we do.